I am Prof.Manavalam. Let us see yet another important and interesting topic, that is medical termination of pregnancy. It is a continuation of abortion. If the unwanted pregnancy, how they are legally terminating means by means of medical termination of pregnancy. Let us see what is medical termination of pregnancy. Medical termination of pregnancy, it is deliberately terminating the pregnancy before the fetus is achieving its viability because of some medical reason. It is a very safe and effective method of terminating pregnancy in early stages. Actually, the medical termination of pregnancy is not legalized in many countries, but it is legalized in India. The Act, Medical Termination of Pregnancy Act, was established in the year of 1971, but the new act was revised and amendment has come during the year of 2021. So according to this, there certain indications are there. If the mother is having the contraceptive failure, or the conception that has taken place because of rape or any other thing, and the continuation of pregnancy may risk to the mother as well as fetus, or the fetus is having any congenital malformation or chromosomal abnormalities, means the type of cases we can terminate the pregnancy by legally. According to the MTB Act 1971, only it is applied to the married woman, but according to 2021, unmarried women also they can undergo the MTP if they are coming under the criteria. And also age limit, earlier it is up to 20 weeks, now it is 24 weeks for rape survivors. And also those who are having the fetal abnormalities, they can go beyond 24 weeks, but they have to get approval from the medical board. Most probably registered medical practitioner, they have to be here and they have to do under their supervision, or they are the person they are doing the medical termination of pregnancy. If in case of breach of any woman confidentiality, those who are undergoing the medical termination of pregnancy, earlier it is only the fine up to ₹1,000, but nowadays it is the particular person, those who are disclosing that information, they may go for imprisonment up to 1 year. There are different methods of termination of pregnancy. So based upon the weeks of gestation, if it is in early weeks of gestation, means only we can do the abortion by providing the pills. First one is medical abortion. Up to 6 to 8 weeks they are doing as a medical abortion. After that, from 8 to 12 weeks it may go for suction abortion. Next, follow that up to 20 weeks or 24 weeks they may go for surgical abortion. It is like a mini labor it may be. So first we will see up to 6 to 8 weeks, most probably they are providing the medication, and also the mother may experience moderate to heavy pain as well as abdominal pain and bleeding. The abortion, the process of abortion, that will be complete. It will be take up to week of time period. The mother may have the bleeding up to 1 week time period. The abortion, it may takes place in a privacy sector, that is it takes place in the home itself, no need of hospitalization for this process. 95% to 98% it is very effective one. Next, move on to the second type of abortion, that is suction abortion. Up to 12 weeks they are doing the suction abortion. In this, here they are using the gentle manual vacuum and the latest techniques. It is very painless, and also the abortion process complete within 2 to 5 minutes. It is most probably the mother has to admit in morning in the clinic, evening after the abortion process they can, after the first 1 hour observation, they can go for home. It is 100% effective. The last one is surgical abortion. Here they are using the dilators and the evacuators. It is also very painful, and also abortion that complete within 20 to 30 minutes period of time. It is also one of the clinical procedure. It is 100% effective one. Let us see what are the medication they are commonly using in case of medical termination of pregnancy. For this medical termination of pregnancy, the mother has to come for 3 visits. During the first visit, they will do the ultrasound examination in order to locate where the implantation has taken place. Follow that only in order to avoid the termination of pregnancy. In case of ectopic, it further leads to complication to the mother. So following the confirmation of intrauterine pregnancy, day 1 they are giving the medication like 200 milligram mifepristone oral. Sometimes it may exceed up to 600 milligram mifepristone. Followed that, if the mother is Rh negative, means they are administering anti-D immunoglobulin 50 microgram. They are giving. Next, second visit, they has to, most probably they no need to come to the hospital. They are giving medication to the mother hand. But day 1 they have to take the mifepristone. Day 3 they have to take 400 microgram of misoprostol, sometimes 2 tablets as a 200 microgram each, either sublingual or buccal or vaginal, oral. Most probably oral they can have it. Along with that, the mother start to have the contraction, so they are prescribing the analgesics, and they may have the feeling of emesis, so they are prescribing anti-emetic. Follow that, they will offer the contraception procedure, that is later. After complete expulsion of the product, they have to come for third visit. Maybe it probably comes around 15th day. So here they are again doing the confirmatory scan. They are confirming, so the product of conception is completely evacuated out or not. They are checking out. If it is completely evacuated out, means they are offering the contraception advices. If it is not, means again one more time there is a chance to administer the misoprostol. Not more than that. Next, the second method, I said no, the suction evacuation. The suction evacuation, here they are having the suction apparatus. So it is in-clinic procedure, no need to go for theatre, but they can done by administering the paracervical block. No need of going for general anesthetic agent in this case. So that is why it is very easy procedure and painless procedure. Here they are evacuating out the product of conception by using the metal cannula or plastic cannula, that is called as Carman cannula. Here, after dilating, they are evacuating the product by using the suction tube, which will be connected with either by metal or plastic cannula. So it is with a particular amount of pressure, they are sucking out the product of conception. Next method is dilation or evacuation. Here, the specialized instrument that is called as a dilators they are using in order to dilate the cervical canal. Either by the dilators, Hagas dilators they are using, or laminate, that is slow method. But nowadays, most probably they are using the Hagas dilators to dilate the cervix. Follow that, it is done under, most probably done under general anesthesia, and they are doing this procedure. Or sometimes they are giving the local agents. Most probably after dilating the cervix, they are introducing the sometimes the suction cannula they are introducing, or most probably they are using the forceps or curettage. So ovum forceps and the curettage are there. They are using that to catch hold the product of conception. They are completely evacuating out the product of conception. Then follow that, they are exploring the uterus in order to know about the presence of fetal product or any placental bits that remain inside the uterine cavity. This is about the procedure of dilatation and evacuation. After the dilatation and evacuation, they are using the curator to curate, to scrap out the endometrium in order to reduce the endometrial thickness, and again they are making ready for the endometrium for further pregnancy, and also to avoid the excessive bleeding. So this is how they are doing the dilatation and evacuation procedure. I hope everyone understand about the medical termination of pregnancy by legal.